Sure. Mr. Kennedy, you're obviously visiting St. Anthony today. I'm just wondering whether the visit today is motivated at all by the upcoming by-election in our riding.
No, well, obviously there's a by-election on the go, and that's an issue. But when I was appointed Minister of Health yesterday, the first concern I had was to visit several of the areas where there are issues ongoing. Flowers Cove being one, and I will be meeting in Lewisport early next week. So, although the by-election is on, it's an issue. It's not the main focus for my visit.
Can you tell me anything about the conversation you've had with the local health authority with regard to Flowers Cove and the X-ray technician and the time of service for the health care down in that area?
Yeah, well, yesterday when we came in last night, the Premier was with me and the Deputy Premier. We went to the Flowers Cove facility and obviously saw the inadequacy of that facility. We then met with the community leaders, the mayors of the local communities, and had a very good discussion where the Premier indicated that there is no plan to close lab and x-ray services at this point in time until a new building, at a minimum, is built. But the discussion we also had was that, look, while building this new building, if there are savings that can be made on the capital expenditures, then we can look at the maintaining of the services that currently exist. There were no promises given, and the Premier indicated that it wouldn't be appropriate to make such promises during a by-election, but that discussions are ongoing. It was a very constructive meeting. The consultative process was very positive.
So we were told that the design work on the new health centre in Flowers Cove area is near done. Before, because we'd been told by Minister Orme that they were looking to go to tender within the next couple of weeks on the ground work. So any idea what's going to be included in it, or will you have to go back to the design table?
Well, what happened was I got appointed or sworn in yesterday at 3 o'clock. By 4 o'clock I was at the airport ready to catch a flight to the Northern Peninsula. We felt it important to get up here and to meet with the people of the area. I was at the facilities in Flowers Cove and Roddington today, and while at Roddington we indicated that there are no plans to change services to St. Anthony or Roddington at this point. And essentially we're saying to the people of Flowers Cove, if you're willing to work with us, and if there's a way that we can provide you the building that you need, not necessarily a Cadillac, but a very functioning facility, and if there's ways that we can save some money on the construction of that building, then we will look at the lab and x-ray service.
There's been a lot of talk about learning a lot. What did you learn, Anchor Point?
I learned, for example, that the people of the area want to be certainly kept informed and want to discuss any changes that are made. I explained to them, and the Premier explained to them, the difficulty with the emergency services, that as a cabinet, and I must emphasize that any decisions that Minister Orme was making, or any positions he was putting forward, were those on behalf of cabinet. The minister is simply the messenger. We learned that the issue of savings, and whether or not those savings would be as great as we had believed. So we learned a number of the practical issues that surround the issue of the lab and x-ray services and the cutting of the emergency services.
Considering that before the decision was made to make the cuts, that the health authority and the health board and local community leaders weren't consulted, and then there were the protests and they were consulted afterwards, and since then the cuts have been largely reversed seeming as a result of those consultations. Do you expect that the Department of Health will talk to people on the ground more in the future when it makes decisions? Well,
the point I made yesterday upon becoming the Minister of Health is that I want to talk to people. I want to find out what's going on in our system. I want to talk to not only the board or the board members. I want to talk to the nurses and doctors who are working in the system. I want to talk to the professionals. We had indicated yesterday that I was looking at the possibility of creating several advisory boards to assist. So I think the process of consultation is a very important one. It gives people the opportunity to have their say and also to indicate where they see our healthcare system going. The healthcare system is the biggest issue that we face right now in this province, and affects the lives of each and every person in this province. So I don't know what consultations took place in previously. All I can tell you is that we're going to be visiting the facilities. I'm going to Lewisport on Monday or Tuesday. And on that process of discussion, the two doctors here in St. Anthony, Dr. Beveridge and Dr. Fitzgerald, they had sent a letter to the Minister of Health. I got sworn in. I was sworn in yesterday, I think, at 3 o'clock. By 4:30, I had an email from Dr. Beveridge. They were both out of town today. I spoke to them by telephone.
Yeah.
One was in Ottawa and the other was in another part of Ontario. Spoke with them, and we've set up a meeting to discuss their concerns October 20th in St. John's.
How urgent, like the letters they wrote conveyed the sense of urgency about the need to get 2 new surgeons recruited basically by next spring. 2 graduating surgeons, bring them up there, and in order to do that, the need to be able to put together a package to offer them, right? Now, would you, when you go to, you've read those letters, so when you go to meet with the doctor, with the 2 surgeons, Dr. Fitz and Dr. Beveridge, will you be willing, will you be working at putting together a package, or willing to consider putting something together earlier so that they can have it, try and find someone?
Well, what I explained to the doctors, in my previous role as president of Treasury Board, I was responsible for the collective bargaining, and during that collective bargaining, one of the issues that continuously arose was the issue of the market modifier, or the market adjustment. In other words, that as a government, we realized that we may have to pay certain professions more money in hard-to-fill, hard-to-recruit areas. So what the doctors were saying in their letter, certainly a situation that appears to me at first glance could be addressed by the market adjustment. As a government, we're currently in the process of adopting or developing the labor market adjustment policy, and I indicated to them that this is something that we take very seriously, that we realize that in the provision of health care to rural Newfoundland and Labrador, you have to have the health care providers, and the issue of doctors, nurses, social workers are ones that we are well aware of. So overall, I indicated, look, this is not something that's outside the realm of what we are discussing. I think part of the difficulty was that they weren't aware of how far we had proceeded with that.
The tenders for X-ray equipment for Roddickton and Forto have been put on hold. I don't know if you've been briefed on this, but is that permanent, or is that just contingent upon a review of the provision of X-rays?
No, I just became aware of that today when I was in Roddickton. That's something that I will be checking into when I get back to St. John's, and we've certainly something we will be reviewing. But where there are no changes planned for the Roddickton area, I don't know why that would be put on hold. But it is something I certainly will check into.
Okay.